أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. My elders, brothers and sisters in Islam, assalamu alaikum. So inshallah we'll have two different PowerPoint presentations first. One will be on sleep and aging, medical and Islamic perspective, and then a little bit on ophthalmology and disorders of the eye. And then Dr. Karar Ali is going to moderate a Q&A session and a general discussion about high blood pressure, cholesterol, and many other diseases, inshallah. So we'll go ahead and get started. So before we talk about sleep disorders, we have to talk about normal sleep. So there are many things that determine normal sleep, and one of the most important ones is that we all have a biological clock. We have a clock within our brain that tells us when we should be sleepy and when we shouldn't be. And you can, when you travel, when you go abroad, you see how you get sleepy at a time when it's not night, but you're very sleepy because your internal clock is still linked to your home location. Same way other functions in your body. For instance, you wake up in the morning and at a very particular time you need to go to the restroom. So that's also linked to your internal body clock, and it's this rhythm called the circadian rhythm. So it works hand in hand with other things, including light, temperature, etc. So a long time ago, people thought when you go to sleep, you're unconscious and the brain waves are all the same. But as they did studies on sleep, they find out that we actually go through different stages of sleep. So they stage 1, 2, and then 3. Stage 3 is the deep stages of sleep. And then a very interesting thing happens. You go into a stage of sleep called REM sleep, where the brain waves look like you're awake. It's called REM because it stands for rapid eye movement. So that in that stage of sleep, your eyes are moving rapidly. And if you wake somebody up from that stage of sleep, they tell you that they've been dreaming. So that's your dream sleep. It's the REM sleep. So you have these cycles throughout the night where you go through stage 1, 2. Stage 3 is your deep sleep. The brain waves are large, big waves. And if you wake somebody up from that stage of sleep, they're usually very confused. Okay, so how does sleep change as we age? So as you get a little older, you tend to have less deep sleep. So the stage 3 sleep reduces, and you start getting more of the lighter stages of sleep. It's also more difficult to maintain sleep, so you have multiple arousals during sleep, so you wake up more during sleep, and this is all normal. As you age, this is normal that this happens. And then another interesting thing that happens is the biological clock shifts forward. So if in your young age you used to sleep at midnight and wake up at 7 a.m., for instance, as you age, you tend to sleep earlier and wake up earlier. So you may now go to bed at 10 p.m. and wake up at 4 a.m. So this is also normal aging, normal sleep aging. The clock shifts forward. And then as you age, there are more medical conditions, and many of these medical conditions impact sleep as well. And sleep disorders in general are also more common with aging. So this is just a diagram that kind of shows you what we talked about in a picture form. So as a child, you have much more time in sleep. This is the time in sleep, and this is the time awake. So you spend more time asleep and less time awake, and you spend more time in REM sleep. And then as you become an adult, you have more time awake, and it's a little less REM sleep than non-REM sleep. And then as you, in old age, you spend a lot more time awake, and you have more wake even in your sleep. So you have more arousals. And that's just the same thing again, showing sleep efficiency, how much of your sleep is actually spent asleep, and it's less as you age. Okay, so now we look at sleep problems. And I'm sorry, I think the graphic spoiled a little bit, but basically, so I've looked at a few of the more common sleep disorders. So insomnia, snoring, sleep apnea, and restless leg syndrome. So insomnia is generally a little more common as you age. Snoring and sleep apnea actually get less common as you age. Restless legs increases as you age. So we'll talk about each of these very briefly. So what is insomnia? Insomnia is difficulty falling asleep or difficulty staying asleep. And I'm sure most of us have at some point experienced it, but it becomes a disorder when it's chronic, when it's happening on a night-to-night basis, and it's causing problems during the day. So it affects around 48% of older people. So nearly half of older people will have experienced insomnia, and then there are consequences the next day. So how do we treat insomnia? So the first treatment is what we call sleep hygiene, and I'll have a slide on sleep hygiene. These are things you can do, very simple things to improve your sleep and prevent insomnia. There's also behavioral therapy. You can work with therapists who identify what your problem is and why you are having difficulty sleeping, and then they treat it. Nowadays they even have online, for those of you who are tech savvy, there is cognitive behavioral therapy for insomnia. There's so many online websites that offer this. And then if it's a huge problem, you have prescription medications as well, and then there are some other therapies like light therapy, etc. Okay, so snoring. I think all of you know what snoring is. Usually the partner thinks the other partner is snoring, and the person thinks they don't snore. So what causes snoring? So snoring is caused by a blockage of air as it passes through the airway, and I have a picture there. And so that's your nose, the air coming in through the nose, and then as you can see down here, it gets into an area where there's a blockage, so there's noise as you breathe in and out. It's more common with people who are overweight or obese, and with people who have large neck sizes. So why is snoring an issue? Snoring can be a symptom of a much more serious disorder, which is sleep apnea, which we'll talk about next. So sleep apnea is a disorder where you stop breathing during sleep. So at times, if you may have noticed, your partner is, the snoring suddenly increases, it gets louder, and then you see that they're not breathing for some time. So that is sleep apnea. Sleep apnea is quite common. It is diagnosed using a sleep study, and the most effective treatment is a machine called a CPAP machine, which you apply pressure and you keep the airway open. Untreated sleep apnea can increase your risk of heart attacks, strokes, etc. So it's important that if you see these symptoms, you get them diagnosed and treated. So restless leg syndrome. It's a sensation of unpleasant sensation in the legs that makes you want to move the legs, and it's usually worse at night. So it may be pain in the legs, it may be just a sensation that you want to move, you have to move the legs, and moving the legs makes it better. It's generally worse at night. So this is associated with low iron. So if you have these symptoms, you want to make sure your iron is checked, especially an iron test called ferritin. And then if it's still an issue, you replace the iron. There are other medications, and medications are very effective at treating this disorder. Okay, so I talked a little bit about sleep hygiene. So sleep hygiene is around 16 or 17 things that they've done studies on and have shown that they benefit your sleep. So first thing is establishing a regular sleep-wake schedule, especially a wake schedule. If you keep the wake time at the same time every morning, it can improve your sleep. So it doesn't matter if you have trouble falling asleep. It doesn't matter how, if the whole night you had trouble. If the next day you sleep in, then you mess up the next night. So the ideal is you wake up at the same time. That day is going to be tough, but the next night is going to be better. So if you have trouble falling asleep, you want to give yourself around 6 hours in bed. You don't want to spend too much time in bed, because what happens is you associate the bed with not falling asleep. So for instance, if you are having trouble falling asleep and you go to bed early and you can't sleep, now your brain associates the bed with not being able to sleep. So every time you're in bed, your brain thinks, I won't be able to sleep, and so this problem perpetuates. So you actually want to reduce the time in bed. So if you have trouble falling asleep, you want to leave the bed and do something that's not very stimulating. So you want to maybe read a book, not a novel, maybe a magazine. You can read some Quran. You don't want to use bright screen. You don't want to watch TV, computer, cell phone. Another thing in the sleep hygiene is establishing a relaxing bedtime routine. So this could be anything. It could be taking a nice warm shower, a nice warm glass of milk, something you do 1 hour or so before bedtime, rather than doing all your stuff that you're doing and then suddenly going to bed, because your brain hasn't had the time to relax. So you want the bedroom to be dark, quiet, clean. You want to limit fluids at bedtime. You want to avoid caffeine, so no coffee or tea after lunch. And it's good to exercise, but not 3 hours before bedtime, because exercise makes you stay awake much longer. So naps. If you do take a nap, you should take it before 3 p.m. and you should limit the nap to 30 minutes. If you sleep after 3 p.m., if you take a nap after 3 p.m., and or if you have a nap more than 30 minutes, you reset your circadian rhythm clock, the clock we talked about earlier, and that makes it harder to sleep the next night. Okay, we talked about no TVs and stuff in the bedroom. And then early in the morning you want to get some sunlight. You want some bright light, because that regulates your circadian clock. And you want to avoid bright light exposure in the evening. So this is sleep hygiene. Now I'm going to spend a few slides on sleep in Islam. So I used 2 books. One is called Hilyatul Muttaqin and another is a book called Sleep in Islam. It was a book I got from Ansarian Publications. A very good book with a lot of hadiths and stuff on sleep. So sleep in Islam. So the Quran in chapter 39 verse 42 says the believers' souls are taken away at night and then some are returned. Also the book stressed that 1/3 of our life is spent in sleep. So Islam considers sleep very important, and actually there is a lot of literature, hadiths and on sleep and what the meaning of sleep. So Imam Jafar Sadiq, our holy prophet, and Imam Rida alayhi salam, all of them have their hadiths where they said you should eat dinner, you should never go to bed hungry. So which is an interesting I think observation. And then so Imam Ali says, he who sleeps with a full belly sees dreams that are far from reality. So on the one side we're being told you should eat something, but on the other side you're told you shouldn't overeat right before sleep. So you want to keep some gap between dinner and sleeping. And then some of the things you want to do before bedtime. So wudu before sleep, du'as. This book mentioned muhasabat, which is taking account of your life and your what you did that day. So interestingly, this we talked about sleep hygiene earlier, and we talked about a sleep ritual. So this could tie in and could be your sleep ritual. So brushing before sleep, the Holy Prophet and Imam Jafar Sadiq alayhi salam emphasized brushing. So I didn't put the exact hadith in there, but and I'm paraphrasing, but I think it was the hadith of the Prophet where he said he would put his toothbrush by his bedside, so before he went to sleep. So, and then sleep position. So different sleep positions have been discussed in Islam. Sleeping on the belly is not recommended. The recommended position is sleeping on the right side with the hand under the cheek. So I just have a few more, couple more slides. So basically, Imam Hassan said you should visit the restroom before going to sleep. Imam Rada said that if you have the urge to visit the restroom, you should go right away. You shouldn't wait. You shouldn't hold it. Imam Jafar Sadiq alayhi salam and the Holy Prophet, washing your hands before sleeping. And then this one was from the Holy Prophet: do not sleep on rooftops or unenclosed places, and do not sleep alone in empty houses. Do not keep garbage in your homes overnight. And then this from Imam Jafar Sadiq, which discouraged bright colors in the rooms of your walls. And then there's a lot of hadith literature on the time of sleep. So there is a particular sleep that is highly encouraged in Islam called kailula. This is the nap before noon. So it might be around after lunchtime or something. It's before noon. Noon meaning not 12 noon, but meaning when the sun is above, right above the. So it's basically right before Zohar time. So there's the hadiths say it's good for memory. Dreams are closer to reality. Now, interestingly, science also recommends this sleep. They talk about the sleep after lunch, and they call it the siesta. And there are a lot of studies that actually show cardiovascular disease is lower in people who have a nap, who take a nap after lunchtime. Unfortunately, I don't think the Western lifestyle is very conducive to that. So we have also been told to avoid sleeping between Fajr and sunrise. And then avoid sleeping before Isha time. Now this is actually in line also with we talked about sleep hygiene earlier, and I said sleep hygiene, the studies show no sleeping after 3 p.m., right? So sleeping at Isha time is not recommended. Sleeping after Asr time is also not recommended, which is in line with the sleep hygiene. Okay, so those are my references, and I guess I will open it up to questions on sleep, and then we'll have Dr. Alireza Sherali talk about eye disorders, and then we'll go forward. So any questions on sleep? So I remember reading the exact hadith, and the hadith said, those who sleep alone or in homes that are empty, they go insane. That was what the hadith is. I'm not a theologian, but I'm telling you I don't know from a science perspective what. Sure. Anybody else wants to? Sure. Go ahead. Go ahead. Mohammed Hadi? Yeah. So I guess it depends. Probably depends on the book and the content. So you don't want something that's very stimulating. If if it's a novel and it's exciting, then you make it harder to fall asleep. But so maybe listening to Quran or dua or something like that might be. So I know we recommend against TVs in the bedroom, and one of the reasons is the tone on the TV is very variable, and that can be very arousing, and it can make you wake up rather than if you have a soothing tone, it's better. So they definitely, the mobile phones, they emit light, especially blue light. Blue light is very arousing to the brain, and those definitely, there's lots of studies that show that it's not good for sleep. There are apps nowadays to eliminate the blue light called blue light filter. So if you can try to do that, but ideally you want to avoid that 1 hour or so before bedtime with your phone. And I tell myself first before telling you, because I'm guilty of this too. But since you asked if there are any recent studies about cell phones, and there is a large recent study that looked at cell phone radiation and brain cancer, and actually there is a link. So that Alireza will answer, inshallah. All right, so I'll go ahead and go ahead.
Just one comment. There are some people that work evening shifts or night shifts, and that really messes up their sleep.
Okay.
And those people, again, a lot of treatments and whatever.
Absolutely, yeah. So there is shift work disorder syndrome. Basically, these are all circadian rhythm disorders, and they're very tough, especially those who are forced to work night shifts and all. And there are studies that show there is an earlier onset of dementia in these folks. There's cognitive impairment. There are several treatments. There's melatonin. You can take melatonin at certain times that helps you to sleep during the day. There's light therapy, so bright light exposure to keep you awake during the night. There's chronotherapy, therapy where you progressively make the time of sleep later. But definitely, if you're working shift works, it brings in a lot of issues.
Yeah, medicine other than pills which help you to sleep, like oil, smelling and oil,
So
something like that.
okay, so for insomnia, so you're asking, so ideally, you want to start with the least invasive treatment. So you want to start with treatments like sleep hygiene. You want to improve your sleep, and then you can do some behavioral therapy, working with somebody to identify what are the issues of why you're not sleeping, and then trying to treat those. There are pills that are prescription pills, but then there's also over-the-counter stuff. So Benadryl, for instance, can make people fall asleep, but it's not recommended in older people in general. I'm not, there are many things on the market that help you promote sleep. Most of them usually have a little bit of melatonin, which is it's a naturally occurring substance, is in your brain produces it, and they market it as with different names, different concoctions, but usually they have a little bit of melatonin and maybe Benadryl in there. No, that's not normal. So yeah, that could be an indication of restless leg syndrome. So if you have pain in the legs and it's worse at night, and you feel the urge to move your legs, that is most likely restless leg syndrome. So the first thing you want to do is check the iron, and you make sure your iron is fine, ferritin is fine. If it's not, you find out why it's not fine, if you're losing blood from somewhere, and you treat it with iron. And if that doesn't work, there are very effective treatments for restless leg syndrome.
One more question. Is there genetics in it? If some family can't sleep?
There are genetic insomnia conditions. There's one condition called fatal familial insomnia, but I'm sure you don't have it because it's fatal. It's a genetic condition where basically you start having inability to sleep, and then you can't sleep. There are actually several genes that they've identified in sleep disorders. They classify people into two types. You might have heard this: larks and owls. So there are some people who generally go to bed much earlier and wake up much earlier. And then there are some people who are more night people. They are classified as owls. And these two genes, there's LRK gene and I forget what the other one is, are implicated in many sleep disorders. So they are genetic predispositions to insomnia, but it doesn't mean if you have the gene, then you're going to get insomnia. There are many other conditions, the environment and other things that impact it. And statins. So restless leg syndrome is associated with many drugs. Selective serotonin reuptake inhibitors are high on that list. Antidepressants, antihistamines, so Benadryl and all these drugs. I don't believe statins are directly linked with restless legs, but statins can cause leg pain, muscle pain, myalgias. Statins are associated with muscle pain generally, not just at sleep time.